So recording and transcription has been started. It is 6 o'clock.
There you are, Shirley.
Hi.
We can see you.
Would it be useful to you just to have a quick introduction from us as to who we are? Do you want to go around the room as to who you all are? But you all presumably know each other, so I don't want to waste your 30 minutes on that. Although obviously it's useful for us to know you all because we haven't all met properly. So shall I? Alan, do you want a chair or do you want me to just run around the room? Shall I run around the room?
Sorry, was it me? Sorry.
Yeah, sorry. I was just wondering whether you wanted to create it. Do you want me to kick off introductions, or do you want to start the introductions? We'll go around the room quickly.
Yeah, I'll introduce myself, Councillor Alan Benson, Deputy Leader, Ockenden Ward Councillor.
Lovely, that's great. Thanks, Alan. Councillor Stringer?
Yeah, Eddie Stringer. I'm a councillor for Little Thurrock Rectory Ward.
Great, love to see you. And Councillor Bartlett?
Oh, hi. Yeah, I'm a councillor in Tilbury St Chad's.
Nice to see you. And Councillor Bennett?
So Holly Bennett, and I'm councillor for Corrie and Fobbing Ward.
Lovely. And Councillor Benson? Linda?
Your mic's off. You're on mute, Linda.
Yeah. Sorry, I'm here now. Yeah. And I'm echoing. Yeah, Linda Benson, and I'm councillor for Bellas Ward.
Lovely, nice to see you, Linda. And Councillor Mumford?
Bill Mumford, councillor for Stifford Ward.
Lovely. And Councillor Willoughby has managed to rush home quickly in the car. But is there, I promise you, because his camera's on, but I saw Councillor Willoughby recently. Councillor Irvine. Chris, you're on mute.
Yeah, I was all ready and set for that. Councillor Irvine for Averley and Chair for Adults and Health.
Lovely, thank you. And Councillor Benson. Alan. You've done yours. You don't need to do it twice. Sorry, Alan. Councillor Scott.
Hello, my name's Councillor Bailey Scott, and I am councillor for Tilbury St Chad's, along with Councillor Bartlett.
Lovely, nice to see you. And to Carmel.
Hi there, everyone. My name's Carmel Michaels. I'm an occupational therapist by trade, I guess you could call me. I've got a joint role at the moment in NELFT, which is the North East London Foundation Trust, and Thurrock Council, and I cover the portfolio I cover is across Thurrock adults, community health services primarily, but I have a background in mental health, dementia, older people, etc. So it's really nice to meet you here tonight.
Thanks, Carmel. And Kerry.
Evening, everyone. Kerry Armstrong. I'm head of adult social care, transformation and commissioning. So I'm involved in lots of the kind of health and care development work, and also buying all the services we use.
Thanks, Kerry. And for those that I haven't met, I'm Rob Percy. I'm the Executive Director for Adults and Health. So I look after the directorate that has adult social care, public health, and leads a lot on the integration with the NHS. And as I mentioned to a couple of people just before 6 o'clock, what I was proposing was, because there's been a diary clash for this briefing with audit training for those on audit committee, which is in person at the Civic Centre. My proposal was that with your agreement, and I defer to you, but with your agreement, we do this session for the next half hour, 40 minutes or so. But what I wanted to do was to suggest that we today do the policy framework for integration between health and social care, because there is kind of quite a policy agenda for you to be aware of on a national level. And I just wanted to run through some of that with you, because I think it's important foundation to understand where the NHS comes from, where we come from, what our statutory responsibilities are, who we have to provide a service to. but to be clear that how we deliver that service is very, very flexible. So the different ways that those we can meet our statutory duties in a range of different ways, which is important for you to understand. We do have a strong track record of integrated working with the NHS in Thurrock. It goes back as long as Carmel and Kerry have been here, I think, which is quite a long time. And so what I wanted to do was propose that we may do a second session, if you're interested, on actually how our communities and our individuals, both patients and service users in Thurrock, benefit from the integrated approaches we have as a separate session, because I don't think if we do the policy framework today, we'll have time to get into all the detail as to what this means for our residents and your constituents in the borough. So I would like to suggest that we'll get to the end and we can take some questions if the time allows and you've got time, but we might do this as two hits if that's okay. Does that sound all right in principle, depending on where we get to with the slides? Lovely. I've got a few slides which I've put together. These will be available to you. This session is being recorded, and I will lead on these, and I'm happy with either if you want to take questions on each slide or just let me run through the slide deck in 15 minutes or so, and then we can take questions at the end. Because of how busy everybody is, yourselves included, I know, I have not had a huge opportunity to rehearse this with Kerry and Carmel. So with your permission, I'll give them the opportunity to just comment on any slide and particularly add to anything if they think there's the need to. Otherwise, we'll leave it till the end. My first bit, though, is to share my screen. So here we go. Is that showing? Yeah. Which means that I now lose the ability to see you as well as I might have wished to.
Did you want me to pick up any hands that come up, Rob, if you can't see the screen? Would that be all right then as they go?
That'd be useful. Is that now showing large so you can see the slides? Yeah?
It is, yeah.
Okay, so let me just run to the first slide. What I want to take you through is the national policy framework that we operate within in Thurrock. So the Health and Care Act was in 2022 formally established integrated care boards and integrated care partnerships as statutory bodies. So prior to that, you may have, in the old days, you remember primary care groups, and you remember more recently clinical commissioning groups. They got replaced in 2022 by the integrated care boards, integrated care partnerships. The board is effectively NHS leadership. So in Greater Essex. So there's a Greater Essex ICB, which was actually established this April. And the chief executive of that is a gentleman called Tom Abel. And that has got all the NHS providers. So EPUT, Essex Partnership University Trust, which is the Mental Health Trust, NELFT, which is North East London Foundation Trust, which provides community services. And there I get in trouble because things are shifting a little bit between NELFT and EPUT as to how they look after community services in Essex. And the ICB, the Integrated Care Board, which looks after the money largely and commissions all the services in health. And we'll come on to that later. Its key partners in local governments, Essex County Council, Southend and ourselves, all sit on the Integrated Care Board, are represented. So I am the borough's representative on the ICB. The Integrated Care Partnership is a wider group. That councillors are on the Integrated Care Partnership, as are voluntary sector partners and other organisations such as Health Watch, which is a statutory responsibility to investigate from a person perspective, from a patient perspective, the quality of services delivered across health and care in Thurrock. And there are health watches in Essex County Council and in Southend as well. So the health and that established that act had a lot of the legislation which established how the NHS operates. Going back in time, the Care Act remains, although it's 12 years ago now, the Care Act remains still the statutory act by which adult social care looks at meeting our statutory duties for determining assessments for people with care needs, their eligibility criteria, financial assessment and safeguarding. I'll come on to that shortly, but remember, for those that haven't been on a briefing about social care yet. We look after vulnerable adults, broadly, older people. The definitions is 65 plus, but let's be realistic. Most older people in social care are generally 80 plus, 85 plus would be the general rule. Learning disability, again, adults over the age of 18. Similarly with mental health, and then physical disability and sensory impairment. Now then, in 2019, just pre-COVID, the national government established the NHS long-term plan. That is still relevant to be aware of as a piece of as a kind of a policy document, because it set out the direction they wanted to move towards integration, prevention, so upstreaming interventions to try and move the NHS from being a national illness service that treats people only at a point when they're ill to one which actually promotes people's upstream well-being, trying to stop them from coming into services, and also started talking about wanting to move care more into the community and stopping some of the focus we tend to get on all the focus being on the hospital environment and the acute environment. And that was reinforced very recently last year in the 10-year health plan. And this is a really important reference document for both social care and health, in that it is the document which shifts the whole focus towards the neighbourhood health service and starts to reshape how the NHS and local government should work together. So if I move on, I can revisit any of these slides if you wish. Other things which are important, you may have heard of the Casey Commission. So Baroness Louise Casey was asked by the previous government to undertake a review of adult social care, future funding and how it should be delivered. She's done an interim report which should be coming out imminently with the recommendations for looking at the medium term as to some of the challenges in the NHS and social care working together. And I'll come on to those challenges very shortly, by the way. They're on the next slide or two. And so it's looking at funding flows, accountability, and how we integrate with the health service. And it's likely in 2028 to come out with a wider raft of recommendations, which is being kind of profiled at the moment as potentially talking about having a national care service. And we'll come on to that shortly about the fact that, you know, there are disparities in how services are received across the country and different standards, although despite the national legislation. So that's what Baroness Louise Casey is focused on. She's done a huge amount of engagement over the last 18 months and is now in her first reporting phase, the 2026 reporting phase. Money is a real issue. So the NHS is, I'll come on to this again in a slide in a second. The NHS, remember, is funded out of general taxation, roughly a budget of 150, 160 billion pounds per annum. And adult social care is not. Adult social care is a service which is means tested. I'll come on to that shortly. But local authorities receive a certain amount of money from different grants. So two of the big ones are the MSIF, which is the Market Sustainability and Improvement Fund, and a social care grant. Those grants this year, for the first time, were consolidated into the council's main fair funding allocation. So now we don't get those separate grants coming into adult social care. They come into the council as part of the council's overall contribution, which means some of the ring fence and controls are off, and it can be spent in different ways. It can be spent across the council's expenditure. But that's the way things are. Remember, we now have a 3-year settlement, so we should be able to know what's happening in the next 3 years. For those of you that attended the Health and Wellbeing Board a couple of weeks ago, I think you received a presentation from Christopher Smith and Margaret Allen on the Better Care Fund. So the Better Care Fund was introduced again around the time of the Care Act, if not the year before, as a mechanism to really get NHS and local authorities to start working together. It's a pooled budget mechanism, which is the glue. That's the glue, not he glue, between the two systems. Apologies for my typo earlier. So that is the system which basically charged us 12, 13 years ago with trying to make us work together because we worked very much in silos 13 years ago as systems. Now, we do really work quite closely together nationally and locally. Locally, we work really closely together. We can still do more, we can do better, absolutely. But the metrics through which the better care fund has to be spent include looking at performance on non-elective hospital admissions. So people that end up in A&E and then suddenly get admitted into hospital. So let's try and stop them from going to A&E in the first place. You know, it's quite interesting. If you look at older people that attend A&E, there's a chance an older person that attends A&E will be admitted. There's a very high chance of that. And basically, once an older person is admitted into A&E, the chances are that they will stay there for a reasonable period of time. It is not an exact science, but I'm always guided by someone who I worked with 15, 20 years ago in there, who told me that every week in hospital is equivalent to losing 6 weeks of their mass mobility in marbles, was the expression. It's not a very polite expression, I apologise for saying it, but it is an important one to get across as far as you do not want people in hospital if they do not need to be there. It is not the right place for them to be. So it's really important to try and stop people from going to hospital if they don't need to be there. And then the second metric is around the average length of discharge delay. And the third one that we are focused on at the moment is around admissions from hospital directly into residential nursing care, which should be really small number. They generally should not happen. They do for correct reasons in a very small number of cases, but it should not be the default. Just moving forward, conscious of time, differences and challenges. So the funding, remember the NHS care is free at the point of use, adult social care is means tested. This causes all sorts of challenges you can imagine from a family perspective. So I need that. We're happy to take questions on that. The NHS is the delivery is here. Adult social care is your responsibility. You are the administration. You are responsible for how my directorate and our partners deliver adult social care and our providers in Thurrock. The NHS services, the clinical services around treatment and primary care and mental health provision, they're the responsibility of NHS England. One of the challenges we have is around NHS continuing healthcare. So there are assessments that using a thing called the decision support tool, which will determine whether somebody's needs are so medically driven or medically prioritized that actually their whole care, including their personal needs and their daily living care, should actually be paid for by the NHS. So remember, the NHS pays for those clinical services, social care pays for that daily living support, personal needs, residential nursing care, supporting people to live a life with a disability. But there are some people whose medical needs are such that actually through NHS continuing healthcare, the whole of the bill is picked up by the NHS. That again is often a point of challenge and contention. Again, things are better here than where I worked previously, but it is still work in progress in that space. Similarities. Remember, we all focus upon the individual and our community's health and well-being. That's why we are here. We are here to optimize independence and maximize people's quality of life. It's really important we try and take a primary prevention approach to trying to stop people from getting ill in the first place. So again, if you go back in time, falls prevention or heart attack. So if you had a heart attack in the old days, you wouldn't receive support until you'd had your first heart attack to prevent you from having a second or your third heart attack. Again, falls, you have your first fall before you'd enter into falls prevention programs. We are trying to shift into a space whereby we promote well-being and we have diagnostic support to try and stop you from having your first heart attack, to try and stop you from having your first fall, because that's got a much better outcome and is much more financially efficient for the whole system. So the similarities are we are focused upon the individual and we support each other. We are hand in glove. We do need each other to make it sustainable in the long term. Statutory duty. There are legal obligations on the NHS and adult social care. There's a legal duty on you in the Care Act and me as the director in the Care Act, which means we must meet the eligible needs of people who live in Thurrock who, following an assessment, meet the eligibility criteria. As I said, the way that we meet those needs then can be open for conversations and discussion. So the broad ones are home care for people living in their own home. Let's try and keep them living in their own home. And if they need support to meet their personal needs, be that washing, be that their personal attention, be that food preparation, then that's given through home care. If they need to be in residential environment, then we go into, we have residential homes which provide residential care and nursing care, which is slightly enhanced support with nursing input. We have around 3,300 people at any one time in Thurrock in receipt of adult social care services across the groups. So it's quite a lot of people that we look after. There's a significant number of people that we work with in a preventative way with some of our services in the communities to try and stop them from coming to our services, because if we didn't do the preventative work, then it would accelerate them coming into our meeting eligibility criteria. So we have a lot of work in that space as well at the moment. But we're happy to pick up with you around our statutory responsibilities and how we discharge those. And remember that, you know, there's a national framework. The delivery is local, both of our health services and of social care. So in Thurrock, Basildon Hospital is our main hospital. It was reassessed by the Care Quality Commission last year and did not get a good outcome. And we are working closely with Basildon Hospital to try and improve their services and to try and work with them so that we, as a system, support them in how they look after their patients. Some of that's about really simple things about improving communication, improving relationships between nursing staff on the wards and our staff, improving discharge pathways and the processes. Some of it's about us putting staff in A&E so that people, when they present at A&E, then they can see some of our staff and we can try and we can provide advice information at that point to stop them from being admitted into the hospital in the first place. We have a deficit of GPs in primary care in Thurrock, so we are sure we have the lowest number of GPs per head of population in the country. The Integrated Care Board and Primary Care is looking to really try and address that position. So they are trying to encourage approaches to try and bring more GPs into the borough. I mean, don't hold me to the exact numbers. Between 16 and 18 GPs, ideally, we would need to get into the borough to meet the targets. But remember, not whole of primary care is about GP access. It's also about how you work with your pharmacy services. It's about those community health services. And there's a huge amount of really good practice. So what I mentioned at the beginning, you know, we've been working in an integrated way in Thurrock for many years now. And there's some really good practice that we need to make sure that is recognised as the value it's having both on people's outcomes and you know, also a way of managing our resources so we use our resources as efficiently as possible. I think the final slide is, yeah. So I went through this morning and thinking, you know, that's probably going to be enough hearing from me. I don't know if Kerry and Carmel have been very polite. But what I was proposing to do was take the slides down in a second so that I can bring you back on screen and I can see your hands easier and things like that. But I just wanted to make sure that you had an understanding of what the national policy framework is and the environment within which we have to operate. And take any questions from that. And Carmen and Kerry could particularly answer any questions to the local level. You know, we could talk about our integrated locality team, some of our joint funded posts, how we work together to try and kind of manage people's needs in an effective way. But I'm happy to take these slides down now and just leave you with the offer of doing another session where we would focus more on what the impacts are for our local communities, and also possibly give you a little bit of a briefing on the health and wellbeing strategy, which is currently out to consultation at the moment. It is being refreshed, and it's an important document because not only does it look at prioritising the health and wellbeing of our population, but I think very much reading to your administration's stated priorities around civic pride and wanting to improve the environment. We totally support that, but where where that environmental agenda may be seen as infrastructure and buildings and how places look and the maintenance of it is actually people that will do that. It's people that will support that. It's communities that need to be engaged in providing that. And we are all about the health and well-being of those communities. So if the communities feel well and feel happy and feel engaged, then the chances are they're more likely to look after the environment they live in. So I just wanted to kind of share that with you. I'm going to stop sharing. I'll bring people back on the screen and then I'll be able to get your reaction. I've taken up quite a lot of time going through it. I do apologise. That was a little bit longer than anticipated. Thank you for your patience. Is there anybody who wants to go and say, well, that's been useful or not useful, and whether you want to kind of how much you want to ask now and how much you'd want to leave for a second session?
I'm sure that the team's found that pretty useful so far. One of the things, obviously, when would you be looking to put in place the second part of this briefing?
Well, so Councillor Irving, so what we could do is I'll pick up with Jenny Shade in Democratic Services, and basically, I mean, we've had a better attendance than I think she thought we were going to get this evening, because I think she thought you were all going to be very excited about the idea of an audit commission, an audit committee, briefing on that. So I would propose that we could fit that in to suit you, really. I mean, my suggestion, I don't know, I get to see it by you. We can fit in relatively soon, possibly by the end of July, early August, something like that. I don't think you want to do anything in August. I think that's the message we've received, that you're keen to keep August clear. So it's either before the end of July or the early September. But I'll talk to Jenny Shade about when that could be arranged, and she'll liaise with the group. If that's
fair enough. I don't want it too disparate, because obviously we've got the council coming up, don't we, or the scrutiny panel this month. Yeah, it's the third week, isn't it? 21st, I believe.
Would you like the session this month? It's the 20. Yeah. So would you like the session this month? Yeah.
It might. I think a little bit more grounding in knowledge would be useful. I think if it's possible, of course.
Yeah. I'll pick up with Jenny. Shane tomorrow. She just dropped me a message earlier on saying to make you the offer that we could get a follow-up session inserted. So or this session redone. I think we just do a follow-up, which will have a more localized focus for you.
Okay, cool.
And of that, you'll get the opportunity to hear much more from Kerry and Carmel, who've got that local knowledge, rather than me just giving the boring policy stuff.
Yeah, I think it'll just benefit us. So in our first scrutiny panel, we can actually, rather than look at like dumb lemmings, actually ask the appropriate questions, I guess. Yeah. So you're all keen to get involved, of course. Yeah.
We'll give you some numbers. We'll give you some stats. It's interesting to look at some of the stats around, the key health conditions, dementia, mental health, some of the long-term conditions around COPD, chronic obstructive pulmonary disease, the breathing disease, where the issues are, how we look to kind of manage those from an NHS point of view, and how we try and manage the social care implications on those as well. So we could put something together a bit more granular on that for you, which I think might be useful for you.
That would be really useful. Yeah, once it's not as convoluted as the obesity information we got the other day. I'm still trying to work it out.
Was that my public health colleagues?
Yeah, that was right. Yeah, it was a little bit like I was just thinking. It was like my stepdaughter, when she was 4, got a crayon and scrawled all over it. I was just really trying to find my way about it. I think, yeah, so it was fascinating. Yeah.
I think one of the things outside of these sessions, by the way, over time, all of you have access to us as officers to come and talk to us about anything that you want to talk about, whether that's in a Teams meeting, whether that's face to face. Kerry and Carmel will tell you I'm always up for a coffee. I'll talk to anybody over a cup of coffee. So the more you want to engage and understand things, and the more we can understand your policy priorities and what you want to deliver, then the more we can kind of make sure that we're aligned in how we take this forward.
Right.
Councillor Stringer.
Yeah, I just on the figures you're going to do. Oh, by the way, the coffee is that you buying, or have we got to buy that?
Oh, is that you don't want to know how much I spend on coffee each week? I'll buy coffee.
with the figures you're going to put together for us, could we also have figures on diabetes? Is it possible to do that?
Yeah, yeah. Yeah, I'm sure there is. I looked at Carmel because Carmel's got our best links into primary care, so we could get you some figures on diabetes. Yeah, and
Yeah, we used to get quite a lot of figures through our colleagues in public health as well. They used to be able to pull off really key sort of information around, certainly across Thurrock, but into the different PCN areas, primary care network areas, or what we would call our neighbourhood areas now. And it gives us a real focus if there's a key demographic where there's problems around diabetes, that we can really do some focus work in there from a health and care perspective. So I'm sure if we speak to Ruby, I'm sure they've got that. Emma will have that as well, won't she? So
we'll pick some of that up, and we'll probably bring Ruby into the briefing that we do with you as our Director of Public Health, which is probably useful for you. Councillor Benson. Sorry, Alan, you're still on mute.
That's all right. It's because of your sounds. Just a couple of bits that always worries me is Basildon Hospital.
Yeah. Is that the question? So I mean, I think Councillor Irvine will be aware of this. The next scrutiny, the first Adults Health and Opium Scrutiny Committee, coming up later this month, has got a presentation from the hospital on their improvement plan and their trajectory. Now then, that's for them to deliver, not me to comment on at this point. But I would want to say that we do try to support them as a system. They are making some progress. But I think that's for you to have the presentation and see whether what you think of it. So I would stress that they will come to the next scrutiny meeting with a presentation, which I will speak to them before the meeting to make sure they understand that you probably tell me now. But what I was proposing was they need to just do a little rehearsal with you as to what the care quality inspection last November said about the quality of their service, what the challenges were that were made very clear in that document, and then you need to be aware of that, so then they can explain to you how they're responding to that. So if that's okay with you, I'll have that conversation with the hospital prior to scrutiny to make sure that I think they'll address the agenda you want to hear as to what steps they're taking to make practical improvements on the performance. I've got to be careful what I say, but I would just say one thing. You will have all experienced on the news and in other things presentations from NHS colleagues who often kind of look at things from a very kind of hospital-centric systems tick box approach, and that is something which I think, compared to, I've worked in the Sussex system and the London system, and I think the colleagues here understand they're trying to take a slightly different approach. They are trying to be more people-centered, but the NHS England, the way it behaves, tends to be in that prism, which sometimes people need to be challenged about. So I think ours are trying to work in the right way, but they are slightly constrained by their hands are tied by the way NHS England works, and I think that's a constant tension for them. But they're trying to break out. So I hope I've not said too much there. I'm trying to be supportive, but it is a challenge for them.
Yeah, that's understandable. And obviously we've got health inequality across the borough. All the wards had a report on the members section that they can access their ward on. I think that doesn't reflect the new ward layout, because I don't think Purfleet on Thames has one. I think that's still under the West Thurrock section, but it's worth members having a look at that and seeing what's there about their particular ward, and particularly as we got the two of the Tilbury St Chad's councillors on board with the dust issue, the shorter life expectancy in Tilbury. I think they need to be brought up to date, particularly with the health issue in children. Obesity amongst the children at school, I think, needs to be picked up. Children going into school overweight at 5, 6 of 8 years of age, and leaving school at 16 overweight and into the obese category. And I think that's as much as we can do it. It's a national problem, and we'll do our best, but there are a lot of challenges ahead.
But that's where it links to the environmental agenda and, things like new developments. So Ruby Baines, the Director of Public Health, would have mentioned to anyone who was on the public health briefing last week that we are working with Sport England to have brought £1 million worth of grant into Thurrock to promote physical activity amongst young people. If we can try and support, I don't want to say it, but support people to understand their own responsibility to try and kind of promote their own well-being, because your trajectory when you're young, when I was young, I thought nothing was going to happen to me, but now I'm old, I'm beginning to realize that I could have made choices earlier in my life which might have given me slightly better outcomes rather than what did happen to me sort of when I had my heart attack in 2011. So there is something for me about obesity leads to diabetes, leads to a stroke, leads to a heart attack, and doctors are really clever nowadays. They'll keep us alive. It's very expensive, and we really want to, and you don't have the best life doing it. So there is something about that kind of life course education which I think is really important, and that's something that we could. There's a real opportunity for you to take a leading role in through the health and wellbeing strategy. I always start smoking.
Just be careful with all the activity, because my hips are half hurt now.
Yeah,
after playing rugby, football, and all the other sport I did.
No. There's always a downside to everything, but no, I agree with you absolutely. Anything else at the moment? So we will do. I'll talk to Jenny about setting up the second session. We're looking at. It's been really useful, just some of those comments, because we've got a sense of what you're looking for in doing the second session. So we won't just repeat this. We'll take a focus on giving a little bit more of a kind of a bespoke presentation for what the integration agenda is, and possibly try and loop it into the neighbourhood health agenda, and where we're prioritising our work around neighbourhood health over the next over the next 12, 24 months, which I think would be useful to get your input into and your support for. Yeah.
Could I just ask, sorry, Alan was saying about the numbers for Tilbury St Chad's relating to the dust and things. Where can I find this?
So our Director of Public Health, Ruby Baines, has got an awful lot of information on the Tilbury dust issue. And so if you were to email me and copy Ruby in, or just email me, Councillor Scott, I will forward it to Ruby and I'll ensure she gives response back. It's also it is also managed a little bit through Mike Deneen, who is our Director of Community Safety partnership, because it links into the Environment Agency. So the Environment Agency is doing a lot of work on it, because they need to collate the data, the evidence, to determine exactly the impact the dust is having. So that sits with the Environment Agency to do that work at the moment. But if you forward the concern to me, I will ensure that it gets forwarded, or I will ensure it gets forwarded on to Ruby Baines, or just send it to her directly. She's the Director of Public Health. She's easily found on the system. BAINS.
But I think there are also health profiles. I think that's what Councillor Benson had a look at in terms of the health profiles, which shows kind of what the health priorities are for different wards, their ward profiles. So we can get the link circulated for that as well, and that is available. But I can't quite recall exactly where it is, but we can send the link around.
I think they're all on the intranet now as well.
Yeah, I just couldn't remember where, Rob, to be honest.
Yeah. Okay, any other questions at the moment? In which case, I thank you for your time. Well, I do thank you for your time. And yeah, as I say, if you think of something afterwards, we'll get the next session booked in. Yeah, if you think of anything in the intermediate time, then please just contact me. or Kerry or Carmel, and we'll take it forward. Okay.
That's excellent. Thank you.
Thank you.
All right. Thank you
Cheers.
very much. Have a good evening,
Thank you,
everybody.
everyone.
Take
Thank
care.
Nice
now.
to meet you
Bye-bye.
all.
Bye.
Take care.
Bye. Bye. Bye.
See you later.
Bye.
Bye now.
Try to catch up, Rob, and have that coffee sometime.
Oh.
Yeah, lovely. We'll
See
get
you
that
later.
sorted out.
Take
Salwa's
care.
back next week. So my
Yeah.
EA is back next week, Chris. And so I'll put that down for to get that sorted out. Okay.
Yeah, if we can do, and we'll try
Lovely.
and get Willoughby
Yeah.
and Linda as well involved in the process.
Yeah. Okay.
as
I'll
much
get
as
that
possible.
sorted out, Chris. Yeah.
That's fantastic.
Okay. Have
See
a
you
good
later.
evening.
Take
Cheers
care.
now.
You as
Bye-bye.
well.
Bye-bye.